What is public health? Most people think it's medicine and going to the doctor when you're sick, but that's not what public health means.
What public health is really everything outside of the clinical aspect of health.
Like making sure there's clean drinking water, healthy foods in restaurants, pedestrian and traffic safety, and behavioral changes, like getting people to quit smoking, to exercise, to use alcohol in moderation, to name just a few.
It's a very large field, and it really focuses on prevention. How do we keep populations healthy instead of how do we keep individuals healthy, which is your traditional medical side of the field.
The University of Hawaii at Manoa had a school of public health for 31 years, but because of budget constraints in the late 90s, the school was merged with the John A. Burns School of Medicine, lost its accreditation, and was turned into the Office of Public Health Studies. That program was accredited in 2007, but still does not offer the same number of courses, degrees, and research opportunities. Now UH is in the process of reestablishing the school by 2015 and will call it the School of Global and Community Health.
We'll be a fully accredited school of public health once again here in Hawaii. Right now we're about 70% of the way there with many of the programs that we used to offer in the old School of Public Health.
The plan is to add 2 more master's degrees required to be considered a school of public health, along with an Indigenous Health Master's degree, the first ever in the world, and an undergraduate program.
So hopefully, if the school opens, then we can take more students and train more local public health practitioners.
If we have people who are, committed to the communities here and who have ties here, we'll be able to really improve our health system overall.
This all comes in the nick of time. A recent study showed that most of the 3,000 plus employees at the State Department of Health are in their mid-50s and expected to retire in the next 5 to 10 years.
If our program doesn't train the next generation of the workforce, we're going to have major gaps. And we're seeing this nationwide, that there's major shortages in the public health workforce that need to be addressed before we don't have qualified people to take the jobs.